My name is Dr. Lauren Pierce, a neurologist from the United Kingdom specializing in neurodegenerative diseases. And today I invite you on an immersive journey, one blending personal stories, scientific discoveries, and the most advanced breakthroughs in Parkinson's disease care across Europe. Parkinson's disease. The very name can evoke uncertainty and fear. Many recognize it as a condition of trembling hands or slow movement, yet few truly understand its complexity, stealth, and the relentless progression it brings. This is not just a story of a disorder. It's about people, families, hope, and the scientific pursuit to reclaim time and quality of life. Let's begin with George Müller, a mathematics professor in Berlin. For decades, he was vibrant, animated, and passionate about sharing knowledge. 3 years ago, George noticed a subtle, involuntary tremor in his left hand. It would occur while he sat quietly reading or grading papers, never during sleep. He dismissed it as benign, perhaps a response to stress. But when his wife Anna found him struggling to tie his shoelaces, and later to cross the street before the pedestrian light changed, they grew concerned. As George sought help, his story revealed something so common in my practice: delayed recognition. Like so many in Europe, George assumed his symptoms were just part of aging. But Parkinson's, by nature, is an insidious neurodegenerative disorder, driven by the progressive loss of dopaminergic neurons within the substantia nigra of the brain. The hallmark motor symptoms, resting tremor, bradykinesia, rigidity, and postural instability, reflect not just loss of movement, but a disruption of intricate neural circuits. Beyond movement, Parkinson's touches every facet of life: diminished sense of smell, as Anna also quietly noted, sleep disturbances, including vivid nightmares and speaking aloud, known as REM sleep behavior disorder, constipation, mood changes, and subtle shifts in cognition. When I met George at my clinic, his story was, tragically, universal. By the time most patients consult a neurologist, more than half of the brain's dopamine-producing cells are permanently lost. Why is early diagnosis so elusive? Because the symptoms are nonspecific, often misattributed to aging, depression, or fatigue. But here's where science and compassion intersect. Modern medicine offers not just hope, but tangible, evidence-based solutions. The backbone of therapy remains pharmacological, most famously Levodopa, a precursor to dopamine capable of crossing the blood-brain barrier when dopamine itself cannot. Administered alongside a dopa decarboxylase inhibitor, Levodopa dramatically improves motor symptoms for most. Adjunct classes, including dopamine agonists, MAO-B inhibitors, and COMT inhibitors, can further optimize neurotransmitter balance. Newer generations of medications are transforming patient experience. In 2024, oral extended-release therapies were approved in Europe, enabling more stable plasma levels and minimized fluctuations, granting patients more on-time and less dyskinesia. Vyalev, known in Europe as Produodopa, a novel levodopa-carbidopa formulation, became a game-changer for those requiring continuous dopaminergic support. Yet medication is only the beginning. In Germany, France, and Switzerland, patients like George have access to advanced neurosurgical interventions. Deep Brain Stimulation, DBS, the implantation of electrodes into specific brain nuclei such as the subthalamic nucleus, delivers programmed electrical impulses, restoring movement control, sometimes for decades. Thalamotomy and pallidotomy, targeted at specific motor circuits, remain options for severe drug-resistant tremor or dyskinesia. Cutting-edge research is now reshaping the entire therapeutic landscape. Cellular regeneration stands at the frontier. In 2025, Stem cell therapies using dopaminergic neuron progenitors demonstrated safety and promising signs of efficacy in multicenter European trials. Patients received transplants directly into the putamen, with many exhibiting prolonged dopamine production and tangible improvement in motor scores. These advances suggest, for the first time, that replacement of lost neurons, once the domain of science fiction, may soon become clinical reality. Gene therapy is also on the horizon, utilizing viral vectors to deliver genes encoding enzymes like glutamic acid decarboxylase, modulating neural circuitry and decreasing disease symptoms. The first European trials have showcased meaningful benefit with manageable safety profiles, especially for younger patients and those with prominent motor fluctuations. Immunotherapy, specifically targeting pathological alpha-synuclein with vaccines or monoclonal antibodies, is expected to alter disease trajectory by slowing aggregation and neural degeneration. Clinical studies in Austria and Sweden are advancing rapidly, and public health agencies anticipate regulatory approval within years. No breakthrough would be complete without rehabilitation. European clinics now offer multidisciplinary care: physical therapy, aquatic exercise, kinesiotherapy, speech and occupational therapy, immersive audio-guided motor imagery for gait freezing, and cognitive behavioral training. Each patient receives individually tailored programs, regularly updated to address journey and progression. Manual therapies, including acupuncture and transcranial magnetic stimulation, have supporting evidence for symptomatic relief. Even environmental adaptations, ergonomically designed home layouts, assistive technology, smart cueing devices, help reclaim lost independence. The importance of society, community, and acceptance is profound. Storytelling, narrative medicine, and cinematherapy have taken root across Europe, connecting patients and families, ending isolation, and fostering holistic healing. Parkinson's is not endured alone. It is faced as a community, with research groups supporting data sharing, digital health monitoring, and educational initiatives across the continent. What about the elusive dream of prevention and a cure? There is no proven way to completely prevent Parkinson's, but risk can be modulated by maintaining brain and vascular health through regular aerobic exercise, Mediterranean diet adherence, tobacco avoidance, and minimizing head trauma. Personalized precision medicine, powered by AI-driven predictive algorithms and genetic risk profiling, is making it possible to identify high-risk individuals for early intervention and clinical trial enrollment. The quest continues. Every day, European research labs and clinical centers are developing better diagnostics using machine learning for digital voice, gait, and handwriting analysis, and testing revolutionary disease-modifying compounds, with dozens of new candidates in Phase 2 and 3 trials as of 2025. I have witnessed remarkable transformations. George Mueller, years after his initial diagnosis, is not only able to walk through Berlin's lush Tiergarten with Anna again, thanks to his personalized combination of Levodopa, DBS, and structured rehabilitation, but he also volunteers at mentoring programs for newly diagnosed patients. Anna found her own mission in supporting spousal caregivers, reminding everyone that Parkinson's, for all its challenges, cannot erase hope, love, or human dignity. To all families, patients, and caregivers, you are not alone. The European Parkinson's community is vast and resilient, and with every passing year, tools for better diagnosis, treatment, and support become ever more powerful. As Dr. Lauren Pierce, I invite you to seek early evaluation at the first warning signs: subtle tremors, speech changes, changes in handwriting, sleep disturbances, loss of smell, constipation, depression, or movement slowing. Prompt evaluation by a neurologist can preserve abilities for years, if not decades. Stay informed. Demand excellence in your care. Support research and share your journey because each story, each breakthrough brings us closer to a world where Parkinson's is not a life sentence but a treatable, even preventable condition. If you found value in this message, share it. Subscribe for the latest evidence-based updates and join the European movement transforming Parkinson's care for this generation and the next. For questions, support, or to participate in clinical trials, connect with your local neurologist or reach out to our network. Together, we will rewrite the narrative of Parkinson's disease, turning fear into knowledge and setbacks into hope. This is Dr. Lauren Pierce, signing off and wishing you and your family health, resilience, and a future filled with possibility.